To date, we have had over 1,000 people killed by COVID in our nursing homes across the state, at least according to HSE figures. Over 112 of these in my own constituency in Kildare North, where we paid a remarkably heavy price. We saw at the COVID committee last week the HSE and the Department of Health, and indeed this Minister, had no proper plan for our protection in place for nursing homes. No plan, despite knowing our elderly were at particular risk, despite having the advance warning from Italy, and despite healthcare workers begging for PPE. In their own homes, our elderly could cocoon, but if they were living in nursing homes, they had to take their chances with the virus. This is a devastating inequality. Those who died without their hands held by their loved ones, the families grieving without the comfort of a traditional Irish funeral, and the healthcare workers who risked their own lives to protect these dying patients without adequate PPE. Minister, you are right to seek additional acute hospitals beds. I would have done the same. But you are wrong to relegate the nursing homes to an inferior position. Wrong to allow age put a discount on people's lives. The Department was careless. Careless, according to HSE figures, so much so that the equivalent of 3 jumbo jets crashed across our country. If these planes had actually crashed, we would have had days of national mourning. But luckily, so far, there has been hardly a murmur. And the story in the HSE, the story in the Irish Times this morning about HSE figures, it makes it even more important to have an independent investigation. It must be an independent investigation because with the regulation, the loss of lives, we cannot have the HSE and the Department of Health investigating themselves. Because these tragic deaths, they were not inevitable. In Kildare North and across the state, people want to know the hows, the whys and the whos. Not for blame, because blame is just finger-pointing, but for accountability. Accountability makes us hold up our hands and take responsibility and learn. History shows us that we need that from the HSE and the Department of Health. Last April, I asked you to publish the Fair Deal Private Nursing Homes Private Mechanism Review. Despite a reminder, I'm still waiting for a reply, Minister. We should have this to establish whether homes deemed unviable in that report had a correlation to the clusters of COVID thus far. If there was a correlation, I ask the Minister to take these private nursing homes into public ownership. Care of the older people should not be commodified, privatised or monetised. So I ask the Minister if you will establish an independent investigation into the deaths of nursing homes, and if you agree that in the case of a correlation between these figures, that these nursing homes will be taken into public ownership, and that would be a first step towards the one-tier health system that would befit a real republic.
Well, thanks very much. I want to thank